I'm Sadaf Nawaz, roll number BP16509192, and a topic assigned to me for presentation is furosemide. Furosemide is available as Lusix 40 mg in market. So what is the furosemide? Furosemide is a water pile. Furosemide is also known as diuretic water pile and is used to reduce extra fluid in a body edema caused by conditions such as heart failure, liver diseases and kidney diseases. These conditions may lead to edema, so a furosemide will be prescribed in the condition of edema. This drug is also used to treat high blood pressure. So what are the rational uses of this drug? Furosemide is a low diuretic water pile that prevents your body from absorbing too much salt, and it may result in more urination. Furosemide is used to treat fluid retention edema in people with congestive heart failure, liver diseases or kidney disorder, nephrotic syndrome. Furosemide is used to treat high blood pressure which may be due to hypertension. So what are the irrational uses? Too much furosemide can cause headache. We have to analyze the condition and we have also to minimize the use of furosemide if it results in following side effects. It may lead to headache, dizziness, pounding or irregular heartbeat, finding as it is associated with low blood pressure warning, low potassium level warning and low thyroid level warning. We have to analyze the amount of these things. If it is decreasing the level of thyroid, मतलब कि अगर ये बहुत ज़्यादा थायराइड को कम कर रहा है और पोटेशियम लेवल को भी, then we will not prescribe too much furosemide. You may also pee more than normal and feel thirst. This drug may lead to risk of acute kidney failure or acute kidney injury. So what are the alternative choice with reasons? We may prescribe Bumix instead of furosemide in treating edema. Why we prescribe Bumix? क्यों हम prescribe करते हैं? Because Bumix is more potent diuretic and has high bioavailability and it is more effectively absorbed in our body. So in condition of edema, we may prescribe Bumix. Some natural diuretics are also there. For example, herb and dietary supplements can also be given. For example, dandelion, ginger, parsley that can also use to excrete water. Thiazoids, for example, furosemide may be preferred over furosemide in condition of hypertension. In hypertension, we may also prescribe furosemide in place of furosemide instead of furosemide. Why? Because it has longer duration of action and is more reliable bioavailability as compared to furosemide. So what are the alternative brands? Three alternative brands with low and high prices with respect to pharmacokinetics point of view. In pharmacokinetic, we have to analyze the price of the drug. So the drug having the least price is sold more. So furosemide, it has retail price. Its retail price is 165. Furosemide, its retail price is 111. Ondil, its retail price is 55. So the drug having the least quart will have more pharmacokinetics. So the Ondil is sold more as compared to other brand. It is the cheaper one. What are the evaluable dosage form according to preference? Evaluable dosage form with which one is preferred in which conditions? Oral or parenteral, etc. Intravenous route is twice potent as compared to oral route. As we know that intravenous drugs have more efficiency as compared to oral ones. US brand name Furosemide MD injectable Lasix injection is used to treat fluid retention and swelling. It may be caused by congestive heart failure, liver disease and cirrhosis. And the other US brands, for example Furocort, oral route, it may be worked by acting on a kidney to increase the flow of urine, so it treats fluid retention, edema. Furosemide 40 mg tablet is prescribed in mild to moderate hypertension when brisk diuretic response is required. It may be used in a condition of hypertension, mild to moderate. So what is the drug-drug interaction for furosemide? Lasix may increase the autotoxic potential of aminoglycoside antibiotics, especially in the presence of renal function. Except in life-threatening situation, avoid this combination. So we don't have to give Lasix with aminoglycoside antibiotic. It may result in autotoxic side effects. And there's also risk of autotoxic effects if cisplatin and Lasix are given concomitantly. मतलब कि आपको इन दो ड्रग्स को साथ नहीं देना है. It may lead to autotoxic side effects. And then we have a case study. A 30-year-old male patient is brought to the emergency department with shortness of breath, a respiratory rate of 30 breaths per minute. Intercostal rear traction is also absorbed and frothy and pink septum. As the symptoms indicate, this patient is suffering from pulmonary edema. Which type of diuretic will be prescribed? So first we have to make SOAP notes. What is the subjective? Our subjective is 30 years old male patient. Then what are the chief complaints? He is complaining shortness of breath. Then what are the characterization? Intracostal retraction and frothy and pink septum. And what is the location? As the pulmonary edema is related to the lungs, so the location is the lungs. As shortness of breath may indicate it has bronchitis and asthma, but there are more chances of pulmonary edema. And then what is the subjective? A respiratory rate of 30 breaths per minute. There is a shortness of breath. Then we have assessment. We will ask him to go for diagnosis because he is suffering from shortness of breath. We may ask him for chest x-ray, as shortness of breath may be due to pneumonia or other heart or liver or lungs problems. We will also ask him to go to test his oxygen test in order to evaluate concentration of oxygen in blood. We may also ask him to go for electrocardiography in order to evaluate cardiac output. Then what should be our plan? Our plan would be a diuretic. We will prescribe him diuretic. Furosemide 40 to 80 mg will be prescribed as this case is related to pulmonary edema. In case of pulmonary edema, we will prescribe water pile, and the most important is furosemide. Along with furosemide, we will also ask him to take some dietary items, for example, potatoes, Spanish, oranges. Why we are prescribing these dietary items? As the furosemide may lead to hypokalemia, so we will ask him to take these items in order to maintain high potassium level, which may reduce hypokalemia that may be due to furosemide. And then references. I have taken this case study from www.druginformation.com, RX list, ePharma guide, MD web. Thank you.